Leading cause of lifelong disability, affecting about 800,000 Americans every year. Diagnosing a stroke quickly is key, but that can be tough in a crowded emergency room. So now many hospitals across the country are turning to Telestroke. This may not look like a neurologist diagnosing a stroke, but that's exactly what's happening. This is Dr. Kristen Miller doing a virtual stroke evaluation. It's called Telestroke, a program that brings stroke experts like Dr. Miller into an emergency room virtually.
Telestroke are essential services for hospitals because not every hospital is going to have access to or resources for a stroke expert. Using Telestroke, we can offer that bedside evaluation and acute treatments, time-sensitive interventions to these patients virtually.
Since the Telestroke program started at University of Michigan Health in 2016, it has expanded to cover 10 hospitals across the state, and about 50% of emergency departments in the U.S. have access to the Telestroke network.
So Telestroke services are basically a way to bring a neurologist, a stroke expert, to the bedside of a patient at presenting to their local ER with stroke symptoms, just virtually. We will review imaging, oftentimes evaluate a patient, and can offer treatment based on their symptoms and presentation and if it's appropriate.
This high-level evaluation in the emergency department can be a real difference maker for someone dealing with a stroke, which can sometimes be misdiagnosed.
A stroke is usually a blockage of an artery in the brain that causes lack of blood flow to a certain area of the brain, and death of those cells. Many times stroke symptoms will depend on where in the brain that artery is blocked. So you can have anywhere from speech difficulties to vision difficulties to weakness on one side of your body. There are strokes that can cause bleeding in the brain, but most strokes are a lack of blood flow problem.
As this technology grows, remember this non-technical acronym to identify a stroke. It's FAST. F is for facial drooping, A is for arm weakness, S is for speech difficulties, and T is for time, meaning call for help immediately. That's Health Works. I'm Dina Santafanti.